Hi, this is Dr. Antelak from thegentlendentist.com. We're located out in Shelby, Township, Michigan. Our phone number is 586-247-3500. The new buzz in dental whitening right now is Kor Bleaching. It's a way that we can combine in-office bleaching with home whitening, same thing, and combining the two make an awesome difference in patients who have sensitive teeth and really want a profound change in their smile. Bleaching, whitening is one of the most requested services that we do in cosmetic dentistry. So I thought I would go ahead and show you with Nicole, who is our whitening specialist, and she's going to we have a patient of ours that he's got quite dark stained teeth. We're going to end up doing veneers in his front teeth, but we're going to want to whiten his other teeth so we can match the veneers up to some of his front teeth. So I am actually going to be recording this and doing it in an interview style with Nicole, and that way you can kind of hear our interaction back and forth while observing what we're doing with our patients. So I hope you'll find this entertaining and also very enlightening. And if you do need to reach us, you can even email us at info@thegentlendentist.com. Thank you.
Hi, my name's Nicole, and we're doing Kor Bleaching on one of our patients today.
And Nicole, tell me, what is the benefit of Kor whitening over other types of systems?
Well, the system is used a little differently than other systems. One of the special things about Kor whitening is that we keep the material refrigerated, and it's cold, and as soon as we put it on the patient's teeth and it gets warm, it activates and works a lot better than some other materials.
Right, and I noticed that in the patient we're seeing today is that he's got his lips are pulled back. He's got some stuff on his teeth there, but he doesn't have a light. Can you tell me a little bit what the difference is between having a light and not having a light?
Well, when you have a light, it dries out the teeth a lot more than without a light, and it can make the patient's teeth a lot more sensitive and them have a lot more sensitivity and discomfort with the process. So this process, we don't use a light, and if you see the green material we have here on his tissue, this is a dental dam material that we use that protects his tissue from the bleach. And then again, with putting the bleach on cold, then it activates and works on its own.
So with this bleaching process, the Kor whitening system, what kind of sensitivity do you think he's going to expect? You know, a lot of times you hear of, I know with some of the light systems that use lighting, that system, a lot of times people get like zingers and they'll have some pain afterwards. Can you tell me a little bit about the sensitivity issue with Kor whitening?
Patients experience a lot less sensitivity than they do with a light. Because of that, because of the drying of the teeth, and that's what creates some of those zingers that patients experience. There is some minor sensitivity that patients experience with bleaching altogether, even with home bleaching. But this Kor system is a lot less.
And I think the reason why too is that with using this system, because it's refrigerated, it doesn't use any acids to keep it. So tell us a little bit about that.
Yeah, it doesn't use any acids. It's a peroxide-based material. So when you put it on the tooth, that's when it becomes active, and it decreases sensitivity.
And sensitivity sometimes can, when things are stored as an acid to preserve the bleaching material, that acid will actually make the teeth sensitive too. It kind of etches the teeth, doesn't it?
Yeah.
Yeah, and so this is a neutral pH, and so it doesn't have that. And also we have a sensitive. Tell us a little bit about the desensitizing process.
Yes, with this process, we send the patient home with a desensitizer that's used before the actual procedure, and then we use it before we start and after we finish, and then they continue using it at home to prevent that sensitivity.
Okay, great. And that's one thing that's kind of neat with this Kor system is it uses both the home whitening system and the in-office system very effectively too. So we're going to find a nice result, and we'll talk with our patient when he gets done.
Okay, so our session has ended, so I'm going to go ahead and remove the bleaching material right now. So we use this tip to take all the bleach off before we rinse, so that he doesn't have to taste it at all.
Great. Well, let's see what it looks like when you're done. Okay, so now Nicole, you took off the material off of there.
Yes.
Okay.
We just ended the third session.
Okay.
So I was just telling our patient here that you're going to notice some little white spots in the teeth for the next couple days, and this will all even out on its own. So we'll have him come back for a final color.
Okay.
And we'll see how he does. I mean, he's going to continue using the bleach at home whitening process.
So this is after.
So that when he came in today, this is what color he was.
Okay.
And this is what he is now. So you can see what a difference it's made.
Big
And the
difference so
bleach
far.
will continue.
What a difference, eh?
Huge, yeah.
Holy smokes, yeah.
Wow. I thought it was a big difference just with the 2-week at home.
Yeah. So you started off. We did it a couple weeks at home.
Yep.
That kind of primes the teeth and gets them ready for this power session. And
I was a little worried about that too, being a little sensitive, but I didn't notice anything at all.
no sensitivity. And how about now? How does it feel now?
It feels fine.
Feels fine.
I know during the process I noticed just a little bit of burning on the gums, but
Yeah.
you know, once she fixed the damming area, that wasn't a problem
Yeah.
either.
Yeah. That's very, very intense material, so it's really important.
Right.
So great.
I
Well,
don't even notice the spot we touched with the lip.
good. Yeah, that's
on
all
the lip
healed.
right here.
Some vitamin E we use, and it's good. So we're going to be doing veneers on you next time, and your front
Hopefully.
teeth. Yeah. And so we're going to give the whole thing. We'll see what it looks like when we're done. So
Wonderful.
Very good. Okay. Thanks a lot.